Dr. Brandi Freeman is an assistant professor of pediatrics at the University of Colorado School of Medicine, and she joins us this morning from Denver. And Dr. Freeman, thanks for being with us. First things first, do we know yet what is causing us to lose our sense of smell when we get COVID?
So, what we understand thus far is that the virus, for some reason, likes to a- affect or attack our olfactory nerves. Why that is, we're still figuring that out. But there are other viruses that do it. And so it's something that we see but has been sort of pathognomonic for COVID-19 so far.
And this is the thing that is causing so much distress, the issue leading to kids not eating. And also, as we pointed out, significant weight loss, up to 20 or 30 pounds in some cases. So what advice do you have for a parent who has a child who's dealing with this, and how do they get past it?
So I think the first thing is to talk to your child. Ask them why aren't they eating. It may be a child's explanation of why they're not eating, but I think that's the first place you go to get information. The second thing you're going to do is talk to your primary care pediatrician or your family medicine doc. Having that conversation about your child's symptoms and trying to figure out what the best course of action is going to be something to help them get to that next step. And the third thing is going to be, once you've had that conversation with your primary care pediatrician, to make sure that you are talking to them and talking with other providers to try to figure out what it is can help your child get better.
You know, kids don't always communicate in the best manner. And parents sometimes lose patience with kids who don't communicate in the best manner. How do you know the difference between a child that says that they don't want to eat something and a child that believes it smells like garbage and doesn't want to eat it because it just smells so bad? They can't get it past their nose, literally.
Yeah, I think that's one of the hardest things about this. And it's really just trying to get them to repeatedly describe what it is. If it's often, not to give a bad name to Brussels sprouts, but if it's really just Brussels sprouts that seem to smell bad, it may not be COVID-19 that is causing the problem. But if they're describing this for every single food, that's going to be something that's going to help us understand better that that is what's going on. The thing about it is, there are things once you figured out that it's COVID-19 that you can do to help your child. And there's something called olfactory training. So, this is basically retraining your nose using different smells that are pretty strong. You're going to want to do something like this. It's a pretty safe at home thing, but going to want to do this after you've talked with your primary care pediatrician to make sure you figured out the right diagnosis.
And just let me point out that liver and onions is the exact opposite. It smells great, tastes like, but we won't go into that. So on this issue of olfactory retraining, how do you do that? How do you retrain a nose to smell something that doesn't smell right?
So it takes time, but you're going to use very strong odors. You're going to use things that often are floral or citric, and you can actually buy a training kit to do this at home. But it's important to do, once again, talk to your doctor before you do this. Don't just go to our favorite online shopping store and pick one up. You're going to do it by doing it with your doctor to make sure you're doing what is right for your child and for yourself if that happens to be the case.
And Dr. Freeman, we've had a lot of discussions about long-term COVID. Last week we were talking about brain fog. Now we're talking about that sense of smell. Are you worried that some of these symptoms may be permanent?
I think with COVID, we're still learning every day. And I think what we know is safe. And what helps with these conditions is making sure that you do what you can to protect yourself from the virus, getting your vaccine. And then if you do have complications, we're taking it day by day to see what we can do to make us all get through this.
Dr. Brandi Freeman is the Assistant Director of Pediatrics at the University of Colorado School of Medicine. Dr. Freeman, thanks for being with us. And up next, we'll talk about a new initiative to help kids separate